We continue to follow the potential local impact of the federal funding bill signed into law last week. We know that Medicaid and SNAP are facing steep cuts in the new law, which will have an outsized impact on places like the Mahoning Valley. While the early education program Head Start avoided elimination before the bill passed, that doesn't mean they aren't also feeling the pressure. Caitlin McCarthy looks at how a program for early education is trying to minimize the impact. Hi, Caitlin.
Hi, Madison. The program director for Alta Head Start says while there are no certainties, cuts could change who does and who does not qualify for the program. Families are signing up for Alta Head Start at the Cavelli Center. The program is free for eligible families and helps children 5 and under prepare for school.
From making sure that they have food, we make sure that they have dental. We have a family advocate program that helps their families with any other needs that they might have. So we provide a lot of services for them.
Head Start programs were initially on the chopping block in the federal funding bill, but were not included in the final law. While there are no set cuts in the budget bill for Head Start programs, there are other cuts that are laid out that could have an impact. One of these programs are SNAP benefits. As of a couple years ago, those who receive SNAP benefits are automatically eligible for Head Start.
So that's something that made a lot of our families who might have been considered over income just by a little bit, but they were eligible for SNAP benefits. It allowed them to be then automatically eligible for the program, so that was a huge benefit.
Program director of Alta Head Start, Lori Stelmar, says they may need to go by income, which would make some families ineligible. But even if cuts are made, some may still qualify.
Even if their SNAP benefits get cut in some way, as long as they're receiving SNAP, they're automatically eligible.
As for Medicaid cuts, the irony is that because families would pay so much more out of pocket for health care, their income eligibility for Head Start may increase. With more local news, I'm Caitlin McCarthy.